Hello, my name is Dr. Pamela Allen. I'm an oncologist. I've been practicing for about 8 years, specializing in T-cell lymphomas broadly, including cutaneous T-cell lymphoma. And I've been particularly interested in trying to make the diagnosis, management, and staging more simplified, both for patients and providers. Cutaneous T-cell lymphoma is a non-Hodgkin lymphoma that starts in the skin. It typically is composed of T lymphocytes, which normally help to evade bacteria or other viruses. It's part of your immune system in the skin. But when you develop lymphoma, it can cause either redness, patches, plaques, or even tumors, and sometimes it can even spread beyond the skin to involve the bloodstream, the lymph nodes, or other organs in the body. Mycosis fungoides and Sezary syndrome are variants of cutaneous T-cell lymphoma. They comprise about 60% of all CTCL diagnoses. Mycosis fungoides is typically diagnosed with stringent criteria that involves both what we see under the microscope as well as what we see clinically. Sezary syndrome is the leukemic variant of mycosis fungoides, and typically it's a syndrome that involves blood or leukemia as well as red skin. Probeandctcl.com is a website that was built for healthcare professionals treating patients with mycosis fungoides and Sezary syndrome, which are subtypes of CTCL. The CTCL Staging Tool is a tool that has been developed to ease some of the staging considerations for cutaneous T-cell lymphomas. It's been developed specifically for mycosis fungoides and Sezary syndrome. This tool was developed because the staging for CTCL has become very complex, and we needed a tool that was going to help providers in the community as well as providers in academic centers to help more accurately stage patients. And this tool brings them through each of the compartments in a way that is more user-friendly. This tool is very important for healthcare providers treating cutaneous T-cell lymphoma because this is a rare disease and the median time to diagnosis can be anywhere from 2 to 7 years. Because of the rarity of cutaneous T-cell lymphoma and the fact that many practitioners in the community may only see a few cases of this a year, they may not understand all of the appropriate staging procedures that are involved. For cutaneous T-cell lymphoma, we typically do not perform more invasive staging procedures that are common for other forms of lymphoma, like bone marrow biopsies or lumbar punctures. The staging tool was developed by taking together both the national guidelines from the National Comprehensive Cancer Network, as well as important guidelines from cutaneous lymphoma societies, including the International Society of Cutaneous Lymphomas and the United States Cutaneous Lymphoma Consortium, as well as the European Organization for Research and Treatment of Lymphomas, along with expert guidance in order to develop a tool that was as user-friendly and accurate as possible. When a doctor is referred a patient or makes a diagnosis of mycosis fungoides or Sezary syndrome, they can use this tool that involves a step-by-step algorithm in order to help them to accurately stage and understand the complete full staging of the patient's tumors, lymph nodes, blood, and visceral compartments. This means that when frontline practitioners see a patient with newly diagnosed mycosis fungoides and Sezary syndrome, instead of trying to interpret how to stage each of these compartments based on algorithms that are in various places, they can go to a single tool that will take them step by step how to stage each compartment. The staging really depends on what the patient's initial stage is. It could include anything from just the initial assessment of the skin involvement and the types of lesions, as well as a lymph node exam. And then in cases where the disease seems to be more widespread, it could also involve radiographic imaging and special assessment of the blood using either flow cytometry or T-cell gene rearrangements. This is a compartmental disease, and so unlike other lymphomas where we have a more simple staging algorithm, we stage each compartment separately. The 4 staging compartments include T, which is the skin or tumor, N, which is lymph nodes, M is metastases or visceral involvement, and B is the blood. When we stage CTCL by compartment, Each compartment has different aspects that we look at for staging. So starting with the skin compartment, which is the T, we look at the percentage of the body surface area that patient has that is involved, but we also look at the skin lesion type. There are many different skin lesion types that we look at in CTCL. Patients can present as erythroderma, which is full body redness. They can present as limited or extensive patches, which are non-raised lesions, plaques, which are raised lesions, or tumors. Similarly, when we look at the nodal compartment, the staging for this can be different than what we expect in other forms of lymphoma, where we have pathologic staging systems that depend on the degree of effacement that you see within the lymph node compartment. For the blood compartment, we look at not only whether or not there is an abnormal flow population, but also the clonality and whether that clonality matches the skin. And then lastly, the visceral compartment is also staged usually using imaging to see whether or not patients have solid organ visceral involvement. One of the reasons that this tool is so important is that CTCL has a unique staging system that is used only for mycosis fungoides and Sezary syndrome. In the medical training for oncologists and dermatologists, sometimes if they do not have a subspecialty training within CTCL, they might not have specialized training in how to stage these patients. And particularly if they're only seeing a few cases of these every year, they're not utilizing those skills. This tool is valuable because the staging for mycosis fungoides and Sézary syndrome specifically helps us to understand the prognosis of patients, and it also helps to inform treatment decisions. We treat patients differently depending on which compartment is involved and the degree of involvement. So cutaneous T-cell lymphoma is a disease that presents in the skin. So understanding how different dermatologic diseases look in different skin tones and different Fitzpatrick skin types was very important for us in developing this tool. Healthcare professionals have different degrees of experience with different patients and ethnicities. And so having a common platform that shows how multiple presentations of this disease can present across skin tones can be very important, particularly for physicians that might not have a high degree of a certain type of skin presentation in a rare disease. For example, erythroderma, which means full body red skin, can look very different on fair complexions compared to the way that it presents in darker complexions. In darker complexions, you're less likely to be able to see the redness diffusely, but it can show up more so in the palms, or you can see creases in the skin or more eczematous changes. These differences can be subtle, but are very important for practitioners to see visually.